while bringing healthy fats, the most common ingredient that an Indian household is having is oil.
Oil.
Your take on palm oil?
So palm oil is another made into a villain. So palm oil just a source of decent mix of saturated and monounsaturated fatty acid. So we all say olive oil is good because it is more of MUFA, monounsaturated fatty acid.
Correct.
And the monounsaturated MUFA content in olive oil is around 70 to 80%. Palm oil is different. Palm oil is around 50% saturated fat and 40% are just monounsaturated fatty acid. Whatever we are using here is palm olein. It is a fractionated form of palm oil where they separate the saturated fat, make it lesser. So this palm olein is actually 55% of MUFA. So almost just only some 15% less than the so-called heart healthy olive oil, and around some 30-35% of saturated fat. So it's okay, decent mix. It is nothing to be like a villainized form. No, definitely. Okay. So all the groundnuts oils, sesame oil, mustard oil, all these traditional oils have MUFA content of around 40 to 45%. So the palm olein is the same. But only thing is, in other oils, the rest of the content will be polyunsaturated fatty acids. Here, the rest of the content will be saturated fats. But because of this equal content of MUFA, monounsaturated fatty acids, studies have found that it doesn't rise LDL that much. Many people fear about this rise in LDL. Actually, palm olein doesn't rise LDL that much because of this equal MUFA. So still it is not a problem. There is coconut oil,
Correct,
which is 92% saturated fat. Even though it increases LDL, but it decreases triglycerides, increases HDL. So even though there is a slight increase in LDL with coconut oil, which is 92% saturated fat, staggering number, even more than butter and ghee. But still the net effect on heart is nil. Meta-analysis studies, reviews have proven that even though there is slight variation in this lipid profile, because of this HDL increasing triglyceride lowering effect, the end parameters, outcomes regarding cardiovascular health, MI, they have found that there is a Cochrane review. So the viewers should know that any study, they will be knowing like Cochrane review is the highest form of evidence as we know.
There are multiple research studies, and Cochrane review meta-analysis is the highest form of evidence.
There is a Cochrane review on intake of saturated fats and the heart outcomes. The Cochrane review says that there is no evidence that more saturated fat intake worsens heart outcomes. There is even data that more saturated fat actually decreases the stroke incidence. This is a Cochrane review published in some 2020 or 21, but still our doctor community is not able to come out of that fat phobia.
Because 15 years ago, it was exactly the opposite.
Yeah. So definitely things are changing, evidence is changing, we must also change.
Change it too.
Otherwise people will change the doctors.
Correct. So again, you talked about glycemic load.
Yeah.
Even with fats, load matters?
Depends on fats. We always say we should use fats as a sliding scale. That means we have to decide what is the objective. Say if a person is on low carb diet and if he is a diabetic and wants to maintain the weight, they have to take adequate fat to maintain the weight for the calories. If a person wants to lose weight, he can't take indefinite amount of fat. He has to calculate. So fat has to be used on a sliding scale.
Sliding scale. And it is 1 gram of fat is 9 calories.
9 calories.
So richest form of calories.
Yeah.
So that is why they say whatever oil that you use, you need to be in moderation.
Moderation. So the fats, whatever, even the direct fats, we take nuts and everything, all those fats only. So we have to take in appropriate with what is our goal. Lose weight or maintain weight, depending
or even gain weight.
Yeah, gain weight.
Gain weight.
So for gaining weight, we give a diet which is high in
Fats.
So why we give we give traditional mix to kids, sattu maavu. What does it contain? More of nuts. Ground nuts. So healthy fats to increase the calories. We give more ghee. Why? To increase the calories.
But that sattu maavu with ghee is not for the adult with diabetes. Right?
Exactly.
What is your go-to oil or recommended oil to your patients?
So any oil in moderation is fine, But my recommendation would be to go for less of this PUFA rich oils. That is the vegetable rich oils. That is the sunflower oil, all these rice bran oil. All these are PUFA rich. Even though these PUFA rich oils, they actually reduce cholesterol. That is proven. But later studies have found that even though they reduce cholesterol levels in blood, it doesn't affect the cardiovascular morbidity. Even some studies have proven that it actually increases the cardiovascular morbidity. So that is operation success, but patient died, like that. So even though it reduces cholesterol, it may not be that much healthy, because these are the PUFA oils are omega-6 actually. These are little bit pro-inflammatory. So our traditional oils are fine. This coconut, groundnut, sesame,
mustard.
North Indian mustard, this is fine. Maybe like abroad patients, some olive oil is mufa rich. Thing is fine. Even the saturated oils, coconut, even the palm olein is fine actually.
Avocado.
Avocado, those are fine. Yeah, in moderation.
In moderation.